my name's Carly Christopher. I'm the Macmillan Haematology Clinical Nurse Specialist at Northampton General Hospital.
So in this presentation, I will be discussing myeloma and some of the complications and side effects and how to manage them. You may sometimes hear myeloma referred to as multiple myeloma. Myeloma is a type of blood cancer arising from plasma cells. Plasma cells are a type of white blood cell made in the bone marrow. Bone marrow is a spongy material found in the centre of large bones in the body and where all blood cells are made. Plasma cells form part of your immune system, and normal plasma cells produce antibodies, and these are called immunoglobulins to help fight infection. Myeloma can cause symptoms, complications with bones, often called lesions, which are holes in the bones. This in turn can cause pain in one or more parts of the skeleton. The pain can often be persistent and often described as dull and aching, and usually made worse on movement. Pain is often the most common symptom of myeloma and will affect up to 80% of patients at some point. Effective pain management is imperative and control of myeloma. Fatigue is another common symptom which can persist. This can sometimes feel like overwhelming tiredness, and this is common in myeloma. Patients report fatigue is a challenging symptom of myeloma to cope with. Fatigue can relate to myeloma itself or be one of the complications of anemia or treatment. Myeloma bone disease is another very common and often debilitating feature of myeloma. Bone pain is a common symptom of myeloma bone disease, and this can affect many parts of the skeleton, as previously discussed. Bone fractures can commonly be seen due to myeloma bone disease, and these can happen in various aspects of the skeleton. If there is a fracture in the spine, which is called the vertebrae, this can lead to a collapse of the vertebrae, which is associated with height loss and occasionally compression of the spinal cord, which can be very serious. Recurring infections. These are very common in myeloma patients because of the myeloma or its treatments. These can interfere with the immune system, making patients more susceptible to infection. Anemia is a reduction of blood cells or oxygen carrying the hemoglobin they contain. It can occur as a result of myeloma or treatment complication. Anemia can cause fatigue, breathlessness, and general weakness. Hypercalcemia is a condition where the level of calcium is too high in the blood. It can occur as a result of bone disease in which calcium is released into the bloodstream when the affected bone is broken down. The symptoms of hypercalcemia are thirst, nausea, vomiting, confusion, and/or constipation. Kidney disease, this can occur in myeloma patients for a variety of reasons. The abnormal protein myeloma cells produce can damage the kidneys. Dehydration or vomiting can also cause kidney damage. Peripheral neuropathy, this is damage to the nerves that make up the peripheral nervous system. In myeloma, the nerves that are most commonly affected are those in the hands and feet. This can cause altered sensation, sometimes pain, and most commonly tingling. Myeloma treatments can also cause this symptom, and it's important to talk to your consultant about this. The treatments we usually be discussed with you and with you and your MDT. So treatments consist of mainly chemotherapy and sometimes radiotherapy. Chemotherapies can consist of 2 chemotherapy agents and always steroids. Chemotherapies can be administered in multiple forms depending on the regime, such as intravenous, subcut, or orally. Treatment regimes can be delivered for as long as 4 to 6 months or sometimes continuously. And treatments can be given until there is a good disease response, or sometimes called a partial remission or a complete remission. Some treatments are also followed up by stem cell transplant. This video has discussed in brief the symptoms or complications that may occur when you have a diagnosis of myeloma, which can be overwhelming, but we're here to support you. We have developed some further videos on how to cope with these symptoms and complications. And thank you for watching. For further information and support is available online and by telephone. You can call the Haematology Clinical Nurse Specialist on 01604 545037 between 8:30 and 4 p.m. Monday to Friday, and excluding bank holidays. Additionally, the Cancer Information Centre at Northampton General Hospital is open from 9 a.m. till 4 p.m. Monday to Friday, and you can call them on 01604 544211. And you can also visit the Macmillan website or call their national support line on 0808 808 0000, which is available 7 days a week from 8 a.m. till 8 p.m. All the numbers we've provided are also available in the video description below.